You guys don't know this, but this is the third try. So tonight we are talking on the 7 o'clock talk. We are going to go over a recent study that was released, and I will have a link to both the study and the video below. But it's talking about the ketogenic diet, and we have used ketogenic diets with our patients to help them resensitize themselves to insulin. And as we look at this and we start to read into this, there's generally three ways to read your ketones. Um, First and foremost, everybody likes the urine strips. There's no really inconvenience. You just dip it into the urine stream or cup, and then you see if you have ketones present. That really only works for about the first week. And then after that, your body starts to, if you're going into ketosis, it starts to conserve those. So it doesn't let them spill into the urine because it starts to use them for the processes, the brain, and things like that. We have found that the easiest way and the most accurate way is to use the Keto Mojo. If you go to the products page of our website, you will see the Keto Mojo on there. It is what we have both personally used to track our ketones. It is the most accurate. It also has a strip for glucose, so you can start to see the correlation. And it is wonderful. But what they have found out is right now, what does conventional or current medicine say about high cholesterol, APOB, and that type of stuff?
Well, they always associate those with risk factors, but we know that they look at it wrong. It actually it's been proven that all of their markers that point to cardiovascular risk are actually wrong, and that's why people can go in and get a beautiful report card from their physician, walk out, have a heart attack, and die because it's not calculating real risk.
And so, what Dr. Nick Norwitz, Dr. Adrian Sotomata, and Dave Feldman have done is they actually just published research. And I'm going to kind of flip through this with you and explain it as we go along. That our belief system. So, I'm going to take another shot at the listen to the science people because science is always changing. And why? Because we don't know everything. If we knew everything, science wouldn't change. But we don't. And we don't know how everything works. So now, with this study, and it was a small cohort, it really needs to be done on a much larger scale. But they saw where they took 100 lean, healthy people on ketogenic diets, and they saw that extreme elevations in LDL. Everybody wants to say LDL is the bad cholesterol. It's not. It's a type of cholesterol. It's like saying a hammer is bad. A hammer is only bad if you assault somebody with it. Otherwise, a hammer's a tool. The LDLs, low density lipoproteins, are part of the blood cholesterol profile that we look at. And we know that it's the size of the lipoprotein that matters most. And we were saying for a long time that APOB 100 or APOB was a direct link to cardiovascular risk. And this is now showing that that's not, it raises questions about that assumption. And that's what that is that's an assumption. And so now it's starting to be disproven through people doing scientific research. And so high LDL levels in keto adapted individuals doesn't seem to carry the same risk. And you've heard us talk about it before when we talk about the blue zones. Do those people typically have low cholesterol or high cholesterol?
Oh, hi.
And
and
why
they
is
and they and they live long because cholesterol is it makes your brain, it makes your hormones, it makes it it feeds all the processes of your bodies.
and so you don't want to destroy this tool that your body uses. you want to use the tool in the proper way.
Well, and low cholesterol um, levels have been associated with dementia because you low fat diet, your brain shrinks, it causes dementia. So there's a correlation between there too.
So, in this research, what they have seen is people that the 100 lean, healthy people had an average cholesterol of 254. And some of the participants had levels greater than 500 milligrams per deciliter. Your cardiologist would flip his lid if he saw your cholesterol that high. And as the people were on a ketogenic diet for 4.7 years on average. Now, this is not your dirty, what I call a dirty keto. This is a fiber rich ketogenic diet. There is absolutely a difference. You cannot sit here and think
Well,
that
this is the super strict keto, like what keto is known for. Like this is not. I'm going to try to lose weight, but I don't really like all this stuff, so I'm going to eat bacon and I'm going to eat this and I'm going to eat that. These are like super lean, heart healthy fats, um,
good proteins.
where they're being very mindful of the vegetables that they choose to eat, so that they are packed full of fiber.
Yes. And so it is a fiber rich ketogenic diet, which means that when you look at basically net carbohydrates. So,
They're eating kale,
oh,
asparagus, Brussels sprouts, cauliflower, those things. And then their fats are avocados, olive oil, avocado oil. They're not getting their fats from
seed
bacon
oils.
and yeah.
And I laugh because we ate this weekend again, just as an offshoot. We ate at Bakersfield when we came back from our seminar in Austin, and she got her favorite Dolly salad, and I finished up my Willie salad, and she gave me her Dolly salad. And every time I eat kale, it just tastes like a Brillo
I
pad to
love
me.
kale.
She
Kale.
loves it. I can't stand it. Ugh. It's not that I can't stand it. I just don't like it. But these people, these lean people, were actually showing the same or less plaque. So the question that the study actually brings up,
And some of them actually reduce their plaque.
yep. And so this gentleman, his value, his cholesterol was 648. His triglycerides. Now, we're in the Midwest. If we see high cholesterol, we usually see triple digit triglycerides. So we're talking about people who are in the 120 to 50 150 range in triglycerides, and that just means there's too much in the bloodstream.
Well, and that's because they're eating cheeseburgers and French fries and
Soda
fast food, and then yes, and then they're slamming it down with their soda pops.
or beer. Um, and then his LDLs were 125 and his LDLs were 513. And so when we look at this, it says strikingly, the majority of most participants showed no or minimal progression of coronary plaque, and neither ApoB nor LDL exposure predicted plaque progression. This contradicts conventional point of view that very high LDL and ApoB levels more or less equal heart disease. These data demonstrate that you can have a very high LDL and ApoB on a ketogenic diet and remain at low overall risk of plaque progression. And we kind of hit, I wrote some notes, we kind of hit on this. The people in the blue zones, on average, their cholesterol was over 250, but they typically eat some form of a Mediterranean or lots of seafood diet. And actually, most of the long lived individuals, to Jessica's point, is they have a greater than 200 cholesterol.
Well, and if you follow a bunch of people, they'll tell you that you need cholesterol greater than 200, or you're not capable of building the brain and the hormones and things like that. But you have to follow a good fat diet to have that cholesterol. You don't want a cholesterol that's super high because you're eating French fries and cheeseburgers.
So here's the twist. It says, however, that does not mean being metabolically healthy makes you immune to heart disease. While the population overall exhibited minimal progression of coronary plaque, those participants who had calcified plaque at baseline, so they had a calcium artery score done, and if they already had plaque, then plaque typically progressed.
Well, and the reason why is because that is a foreign body in your bloodstream. So I don't know if anybody knows how plaquing works, but when you go get a stent and they open up the blood vessel, they don't actually remove the plaque. They put a little, this is the inside, the lumen of your vessel, and the plaquing closes it until, and sometimes it completely closes it. They don't actually go in there. You hear people say, oh, they rotor out my vessels. No, they don't. They actually put a spring that opens up and it just pushes the plaque against the wall. And now you have a stent that is going to collect all the stuff flowing through your blood vessels to create more plaque.
And so, in our analysis, we found that LDL cholesterol and ApoB levels did not predict plaque progression. Baseline plaque levels did predict plaque progression. This was true for both with and without baseline plaque. So why does plaque beget plaque? And that's the question they want to look at and start to examine. They also saw in people who were on the ketogenic diet, they also saw that these guys exhibited, 6 of them exhibited plaque regression. And so once again, the study was funded, actually it was crowdfunded, which was kind of neat, meaning that people donated to this so that they could actually run the experiment. And when they did that, like I was talking about before, Keto Mojo, that's the device that we use with our patients. Keto Mojo is actually who put this together and then brought it to the scientific community. So now we have to actually spread the word so we can get, I hate to say it, but so we can get government funding to start to look at much bigger cohorts and to look at more outcomes, because that takes a lot more money and that takes a lot more time. And so we have to have that intervention, because statins in the United States are given out like Pez candy, and statins are one of the most prescribed drugs in the world. And why? That's the biggest question, is why, if we have all of this disjointed evidence, do we still keep giving these things out like crazy when we don't know? Especially to eliminate the first, taking a statin for prevention.
That actually it doesn't work.
I haven't seen any evidence.
And most studies show that it doesn't work. It does work to take the load off of the heart after an event, but only for the first 30 days. Because if you continue to use the statin, it'll actually create the problem it was meant to repair.
And so a lot of people now are going to say, okay, what is the ketogenic diet that is fiber rich, that is healthy? Because a lot of us want to sit here and say, oh, I'm going to eat basically a modified Atkins. Everybody likes the modified Atkins. Oh, I'm going to eat all this protein. And so you have to go off of, for health, net carbs.
And I'm going to add a little tidbit in there that everybody likes this Atkins diet. and they might lose a lot of weight quickly. However, you need to be very careful with that high protein diet because your kidneys have to be healthy enough to process all of that. So be careful and watch your kidney health.
Yeah, they got to be able to handle the hit. So, a healthy, fiber rich ketogenic diet balances low carb and high fat foods with fiber packed options to support digestion and overall health. This is something that we have seen in our patients. I have seen it in myself when I was doing microbiome studies on myself in series. When I was on a ketogenic diet, I actually, let me correct that. When I was on more of a Paleolithic diet, heavy in protein, there is a portion of the microbiome that is pro-inflammatory. And one of the bugs in there that is really pro-inflammatory that has been linked to type 2 diabetes and cancer and everything else like that is Bilophila wadsworthia. I had this when I was doing that type of a diet. Once I started to add more fiber in, and I was getting more bioflavonoids and polyphenols, he disappeared out of my microbiome. And that's what I want. And that's what most people want. So if you're just doing, I'm eating butter and I am really consuming crappy forms of carbs, simpler carbs, just trying to keep the carb content down, and I'm not worried about fiber, polyphenols, and bioflavonoids, it will wreck your microbiome.
And please don't go adding psyllium husk to your diet thinking you have fiber or to add fiber because psyllium husk has no nutritional content for you or your gut bugs and it's just a filler. So please don't put teaspoons of psyllium husk in whatever. You need insoluble and soluble fibers so that you are feeding your microbiome because your gut bacteria need nutritional fiber so they can break it down and be healthy. And that is not psyllium husk or metamucil or things like that. You need to get it from a high quality insoluble and soluble fiber. One that we like is Indifin, comes from Metagenics, and or get it from food.
Yep.
Your kale, your spinach, your cauliflower, your asparagus, your Brussels sprouts.
So macronutrient breakdown: carbs 5 to 10% of daily caloric intake, and you want to prioritize fiber-rich sources, and that's 20 to 50 grams of net carbs. If you are actually exercising and doing a lot of working out, you can increase the carbohydrate content. Your fats are 70 to 80% of your caloric intake, and you want that from healthy fats like avocados, nuts, and good oils. Your avocado, your olive, that type of stuff. We don't want cheap seed oils. And I will be the first to admit, I am not sure about all the grape seeds and all of these things. I know they have great omega 3s in them, but we need to be able to measure the rancidity in the fat that we're taking on those types of fragile oils to make sure that they're not oxidized. That I do know. Do I know if they're overall healthy or not? Not sure, because I hear so much conflicting stuff. I just stay away from them because I know there's other ways to get good fats. Protein is 15 to 20% of your calories, and you want to aim for 25 to 30 grams of fiber. So what this means is if you're eating carbs, 50 grams of carbs, and 25 grams of those carbs are fiber, you can actually go up to 75 grams of carbs because that still keeps you in the net of 50 grams of carbs. And just to make it easy, to Jessica's point, key foods: spinach, kale, broccoli, cauliflower, zucchini, Brussels sprouts, asparagus, cabbage.
And most of those are green. Like So think of your green vegetables.
Your fruits in small amounts. Berries, raspberries, blackberries, avocado. Those types of things are good fruits.
And they're berries, not when we say fruit, it's not apple and banana and peaches and oranges. They're berries. They are the high concentrated seeds on them.
Nuts and seeds. Chia seeds. That's actually, chia seeds are good to put in all kinds of things because they add bulk. And there's 10 grams of fiber per ounce of chia seeds. Flax seeds, almonds. Do watch the portion sizes due to the amount of carbs on your almonds and nuts because, like, macadamia nuts are really high in carbohydrate as well.
And try to get raw organic nuts and then toast them yourself, because then you can control the what's in them and on them.
Yep. Your fats, your olive oil, coconut oil, butter, MCT, those types of oils are good. So there's no fiber in those oils, but they are really good staples and good to cook with. And your proteins are just simple: eggs, salmon, chicken, beef.
But make sure they're high quality. Don't buy. Try to get pasture raised farm eggs and salmon. Don't get your farm raised. They it's terrible quality salmon, and it does affect it and you. And pork rinds I know is a really good. Everybody likes them as a treat, but
Careful.
yeah, make them yourself or have them freshly done for you, because if you're buying pork rinds from the store, you have no idea. Most of the time you go get pork rinds, if you actually flip the package over, there's like 25 ingredients and pork is way at the bottom. So what are they?
Yep. And then something that a lot of people don't realize is you can actually have unsweetened cacao as a fiber source, polyphenol source. It's really good to make like a keto, like a golden milk keto with the polyphenol rich unsweetened cacao. That'll help you sleep. It's really good. So, just a sample menu, which has 30 grams of fiber, 25 grams of net carbs, and this is between 16 and 1800 calories. Breakfast: chia pudding, 2 tablespoons of chia seeds, unsweetened almond milk. I'm going to defer to
Yeah,
her.
make your
Make your
own.
own. A quarter cup of raspberries, and one boiled egg. That's 10 grams of fiber, 5 grams of net carbs. Lunch: grilled chicken salad, 2 cups of spinach, half an avocado, tablespoon of olive oil, 1 ounce of almonds, 25 grams of fiber, 5 grams of net carbs. Snack: flaxseed crackers with a tablespoon of cream cheese. Dinner: baked salmon with roasted broccoli, which actually is kind of what we had last night. And then you can do a cauliflower mash, 1 cup with butter, 8 grams of fiber, 8 grams of net carbs. And there you have your, what did they say that was? 30 grams of fiber and 25 grams of net carbs. And that's a lot of food. So prioritize non-starchy vegetables in small portions of high fiber, low net carb fruits. Stay hydrated. Fiber needs water to work effectively. Track your net carbs, total carbs minus fiber to stay in ketosis. Avoid high carb sources, like they don't like you to eat beans on in keto. I maybe wouldn't make them a staple, but having beans, which are really rich in fiber, really rich in polyphenols, once a week is not going to kill you. And it's a good fiber source. They don't like them. They stay away from the legumes. If you keep yourself in or close to ketosis and you're able to eat beans, da, 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 and some people won't like me saying that, I have found that people who do add beans into their diet and rotate them in and out occasionally have much better looking microbiomes than people who just eat protein. So, or just eat fat.
Well, and another thing to add is a ketogenic diet, unless you need it for medical reasons, it shouldn't be a staple diet. It should be a diet that's used as a tool where you go in and out of it.
Well, that's kind of that's our belief. And the way that I look at this and the way that we kind of have a consensus is if you can get yourself into and out of ketosis relatively easily and you're pretty healthy, that is a much better way to live. Now, if you're obese, if you have issues with blood sugar and insulin, a very strict ketogenic diet is the way to go to help resensitize the cells to insulin short term.
And then we like to see people move into a more Mediterranean lifestyle.
And we don't even really try. I mean, our lifestyle is this way, and we are always at the low level of ketosis, always have zero point 0.3 to zero point 0.5 nanograms or whatever the measurement is of ketones in our blood. She actually can push her ketones a lot easier than I push mine. But once again, blood sugar is good, insulin is good, and that's what we try to maintain. And that keeps us, honestly, healthier than 90% of our friends and family because I watch people move. I was just shooting not too long ago and I was watching my friends pick up the casings and it pained me. I mean, they couldn't deep knee bend and get down and pick up their casings. They were bending over and reaching with their fingers to pick them up like they had chopsticks. And these are my friends and I love them and I don't criticize. I don't, if they come to it, they come to it. I did say something. I did say, hey, you guys should really pay attention. You're losing your mobility. And that's not good in your 50s, especially if you're going to live to be 70 and 80 years old. Because, you know, if,
Mobility is related to directly correlated to health and longevity.
and whether or not you end up in a nursing home, because if you can't wipe your own butt, if you need help, you
Yeah.
can't get off a pot, there you go.
I also wanted to add for the people that are interested in the plaquing, and you can, they say you can't reverse plaquing, but there's been studies to show that there is a diet that can reverse plaquing and does reverse plaquing, but it is super strict and most people can't
Adhere to it long
adhere to
term.
it, but you need to be followed by a medical doctor very closely, and it is the Ornish diet.
Yep.
Research that.
Ornish diet, if you have plaquing, the Ornish diet has actually been shown to reverse plaquing. And guess what? It has been so successful that Medicare pays for it.
Yeah.
So if you have plaquing, and we're in the Midwest, I guarantee you haven't heard that anywhere in the Midwest because they just, I don't know. I don't know if they just don't care about us or what the deal is, but that's why we're here to tell you guys, hey, and we're here to help. Pay, stay tuned. Let me say this. Stay tuned because we do live in an impoverished area. We know a lot of people can't afford the testing that we do, but we've been working very, very hard to find something that will help 80% of the people out there.
So it's not a functional medicine program, but it will step you into it, and we're excited about it.
Well, it's functional medicine and it's functional nutrition.
Yeah, but it's a do-it-yourself.
Yes.
I'm gonna give you this, and you are going to take it and work on you until you either fix yourself or you need a little more help, which will then we can step you into the actual program.
So stay tuned. It's coming very, very soon. Have a great one, and we'll see you next time. You can find us on Instagram, Facebook, YouTube. Our website is www.integratedhealthofIndiana.com. I'm Dr. Miller. This is Nurse Jessica. You can email her at mrsindianabackdoc@gmail.com. And you can reach me at Dr. Miller, Dr. Miller at integratedhealthofIndiana.com. Or call up Tina. Everybody loves Tina. 812-346-1757. And we can sit down and have a 20-minute consult and start to help you get on track with where you want to go with hitting your health goals. Thank you.
Thank you for taking this time to look into the health of you and your loved ones. This broadcast does not constitute a doctor-patient relationship. It is intended for educational and entertainment purposes only and is not a replacement or substitute for care. If you are having issues, please seek a qualified professional trained in functional medicine. We would be happy to be of assistance with both in-person and virtual consultations. Thank you.